Are the Medicare Advantage PPO plans better than the Medicare Advantage HMO plans? Maybe. Hello, I am Kevin Canals, a licensed independent health insurance agent, and I help people review their Medicare options. And in recent years, we've seen more and more Medicare Advantage PPO plans come into the marketplace. Now, one of the benefits of a PPO Medicare Advantage plan, preferred provider organization, is that you can go out of network and receive potentially some coverage for those healthcare services, but it will be more expensive than if you stayed in the network. Now, with the Medicare Advantage HMO plans, there is never any coverage if you go out of the network. You are on the hook for the full cost of the healthcare service. And that's one of the nice things about the Medicare Advantage HMO plans is they offer predictable costs. So people know exactly how much their co-pays are going to be for office visits, labs, tests, x-rays, and if they are hospitalized. But of course, some people have doctors that aren't in any of the Medicare Advantage networks, and they want to go see those doctors occasionally for healthcare services. But let's kind of look at how the HMO plans versus the PPO plans differ. Now, one of the things you will notice is that generally the Medicare Advantage PPO plans have a higher premium. Not all of them. There are many HMO plans with a $0 monthly premium, and there are usually some Medicare Advantage PPO plans also with a $0 premium. But many of the PPO plans will be up there. They're going to be more expensive on a monthly basis for the plan enrollment. Now, with the PPO plans, there will generally be an out-of-network deductible that you must first meet before you go into a coinsurance. And this PPO medical deductible can be anywhere from zero up, I've seen some that are $750. So you need to spend the medical deductible for those healthcare services before the plan will start to share in the cost of those healthcare services. So you need to be careful and cognizant of those first dollars when you go out of network. With the out-of-network cost sharing, once you have met that out-of-network deductible, there can be, the coinsurance can range anywhere from 30 to 50%. So if the office visit is $200 and the coinsurance is 30%, you're going to be paying, $60 after you have met that deductible. Now, there are some Medicare Advantage PPO plans that just have a copayment for out-of-network services, but you need to compare the copayment to in-network services, and typically the copayments out-of-network are 2 to 3 times higher than if you saw an in-network physician. So, we have to kind of compare that to original Medicare. Okay, so in original Medicare, if you just had straight original Medicare, the Part B deductible for 2024 is $240. Once you've met that, you go into 20% coinsurance for those healthcare services, outpatient, seeing a doctor. So if that office visit is $200, under original Medicare Part B, you would be paying a $40 coinsurance price for that healthcare service. So going out of network with a Medicare Advantage plan is more expensive than original Medicare in some instances. One of the other things that is slightly misleading when the Medicare Advantage plan says you can go out of network, yes, you can go out of network, but they're only going to pay for those services that are provided by doctors, labs, tests that can bill for Medicare. They accept Medicare assignment. So if you go see a physician that doesn't even accept Medicare, it's not going to be covered. So the doctor, the provider still needs to accept Medicare for the Medicare Advantage plan, PPO, to cover any of those costs. Now, there is also a maximum out-of-pocket of the Medicare Advantage plans, which is a real boon because original Medicare has no maximum out-of-pocket. So the maximum out-of-pocket amount means that once you have hit that dollar amount, the plan covers all the costs for the rest of the year. And you will see an in-network maximum out-of-pocket amount and an out-of-network maximum out-of-pocket. So if all of your services you lean towards being out-of-network, you're going to have to spend more dollars before you hit that maximum out-of-pocket amount. And it can be anywhere 2 to 3 times higher than the in-network. So to kind of summarize, the Medicare Advantage HMO plans, they offer predictable costs and protection from really expensive healthcare services. Of course, you have to stay in the network. Now, if you stay in the network with a Medicare Advantage PPO plan, you're going to have those predictable costs and protection as well. But with the PPO plan type, you do have some flexibility to go see some doctors that you want to that aren't in the network, maybe just on an occasional basis. So it gives you some flexibility there to see some of those providers. But just remember, it's going to be a higher cost to you. And when you are going through and looking at the HMO versus the PPO plans, you want to compare the summary of benefits to see how much it's going to cost you. Now, it is very difficult to, you don't know what your healthcare services necessarily are going to be in the next year, but if you know which doctors are in network and out of network, you can kind of start to get a feel for how much it's going to cost you with the PPO plan if you go out of network. And of course, you want to review those providers and make sure which ones are in network and out of network. So, but on the summary of benefits, it'll look kind of something like this. If it's a PPO plan, it'll tell you what the deductible is. If you stay in network, many of them have a $0 deductible. If you go out of network, maybe you have to meet $650 before they do any cost sharing. Office visit in network might be $10, but once you have met that out of network deductible, possibly the coinsurance is 30%, and I've seen some that are higher. Specialist visit in network might be 25, 30% out of network. Hospital admissions, many of the in-network PPO plans and HMO plans will have a set dollar amount per day for a maximum number of days, and then you don't have to pay anymore. So maybe it's $200 a day for a maximum of 5 days. But without a network, it may be 30%, and that can be a lot. That is a big surprise if you did not know that it was coming. So those are kind of the issues surrounding the HMO and the PPO plans. So my advice is just really look at the costs. The PPO plans sound great and they will work for many people, but you need to understand your liability for the costs out of network. So for InsureMeKevin.com, I'm Kevin Knaus. If you have any questions, you may leave those down below. I'll do my best to answer them. And if you have any suggestions for any other instructional videos, educational videos you'd like me to do, you can leave those down in the comment section as well. Otherwise, have a great day.